Hi, I'm Junda Woo. I'm a junior at CASTEM, and here at the Centers for Applied Science and Technology, or CAST, is a network of schools focused on experiential learning with a mission to maximize opportunities for students so that they are college ready, career ready, and ready for life. Here at CAST, we learn by tackling real world problems hands on.
Hello, my name is Alberto Alvarez. I am a student, a junior at CASTEM High School, where I'm preparing for a career in engineering. Today we are kicking off our project-based learning lesson entitled Contagion, Horrors and Hope, Illness and Influences Plaguing Humanity. We're excited to partner with John Jay Science and Engineering Academy from Northside ISD to learn more about how COVID-19 has impacted our lives.
Thank you, Alberto. Um, my name is Amelia. I am a junior at the John Jay Science and Engineering Academy, where I plan to become an ophthalmologist. Um, the John Jay Science and Engineering Academy is a school where students who are more focused on math and science and engineering-based careers can go and have a really unique learning experience while still getting like a really fun, or while still being in a really fun and interactive high school environment. So the purpose of today's town hall is to kind of identify what is a contagion. A contagion is a contagious disease or the transmission of a disease by direct or indirect contact. However, it can also be rapid communication of an influence or an influence that spreads rapidly. Contagions can be anything that is spread in a harmful or hope-filled way. And today, students from CASMED, CASTEM, and the John Jay Science and Engineering Academy will be joined by Dr. Junda Woo, Medical Director for the City of San Antonio Metropolitan Health District, as we begin to explore how COVID-19 has influenced our lives and how we can transform these learnings into positive outcomes for our community. Here's Gavin.
Thank you, Amelia. My name is Gavin, and I am a sophomore at CASTMed High School, where I'm preparing for a future in general or trauma surgery. We are grateful to be joined by Dr. Woo this evening. Dr. Woo was appointed as a local health authority by our mayor and city council for Bear and surrounding counties. Her leadership as the local health authority is a state mandated position tasked with diagnosing, investigating, and monitoring local health hazards and enforcing laws and rules that protect community health. She received her Doctor of Medicine degree from the State University of New York and completed her residency in obstetrics and gynecology at Baylor College of Medicine. She also has been a preventative medication physician in San Antonio. She holds a bachelor's in journalism from the University of Texas in Austin and works as a report covering legal affairs at the Wall Street Journal before becoming a physician. Dr. Wu, welcome to our student town hall.
Hi, thanks. Thanks for inviting me to be here.
My name is Savannah, and I am a sophomore at CASMED High School. I chose CASMED because I want to fulfill my dream of becoming a CRNA, which is also known as a Certified Registered Nurse Anesthetist. Today, I will be facilitating the questions and the answer session. We will first address questions pre-submitted by students. However, if anyone watching on Facebook/YouTube have any additional questions, please type them in the comments and we will address those questions at the end. Dr. Wu, I have a first question for you. What have you learned about yourself during this pandemic?
So I've learned that I love not having to touch or be touched by strangers. I don't know, that's one thing that I've learned. How about you? Or maybe, I don't know, I'm allowed to do that, or we go on to the next question.
I think that is allowed. One thing that I've learned about myself is that I have a very short temper with just being on virtual school. I cannot stand it. I actually miss school and I prefer to be at school, but unfortunately that is not able to happen right now.
Thanks for sharing that.
Moving on to the next question, Chibuzo, you have a question?
Hey, Dr. Wu, nice to meet you. I'm Chuzo, and this second question is actually for me. And I'm asking, how does someone's organ system react to the stress of somebody contracting COVID-19?
So everybody's different. I'm sure you all already know that 80% of people don't even have any symptoms, but some of the people who get sick get really sick. About 6% end up in the ICU, and for those people, there's a general inflammatory response that can affect your heart, it can affect your kidneys. So various organs, obviously the lungs, since this is a respiratory infection. So those are the ones that are most commonly affected, and we still don't know things like how do you know who's going to be affected? How long does the effect last? But for instance, for student athletes, that's one of the things we're looking at now as far as returning to play. Hey, maybe we have to do special imaging of the heart to make sure your heart's okay if you were bad enough sick enough that you had to be hospitalized or, well, I haven't actually, I don't know the guidelines enough to know, the cardiology guidelines enough to know if it's just if you were sick enough to be out or if you were sick enough to be hospitalized. I have to review that, sorry.
Hi, okay, so one of the questions that I was wondering is, why do you think that COVID-19 has had such an important, like a vast impact on the poor demographics as opposed to the more wealthy ones?
So I think when people who are poor are more likely to have to work a couple of jobs, and so they're in more contact with people, right? And so this is let's start back up and talk about how do we protect ourselves from getting COVID. So there's distance, staying 6 feet away from other people. There's limiting the number of people who you're around. If you can't limit those things, then at least limiting the amount of time that you're around other people to 15 minutes or less, ideally. If it's less than 15 minutes, then we don't even consider it an exposure most of the time. So if you're working more than one job, or if you're having to ride the bus instead of driving your own car to work, that's a hypothesis. We don't, if you are living in a more crowded space, so somebody who is in your household is sick and they're not really able to isolate themselves and stay 6 feet away from other people, well, then that whole household is more likely to get sick, right? So all of those things play a role, and if you don't have money, maybe you're less likely to go to a doctor when you don't feel so well. And it's important for people to know that there are some treatments for COVID that we have to give earlier. There's some that are better for later, and that there's some that we can't give you if it's already been a while that you've had the symptoms.
How has the start of school impacted the rise of COVID-19 cases, and how can older and younger students protect themselves from it?
Got it. So we're all waiting on pins and needles to see what happens. One of the things is that the incubation period of the virus is 2 to 14 days. So that means that school started on the 8th, right? So if nothing happens by the 22nd, then we'll know that at least for this small number of people restarting school that we haven't seen a big difference. Now, school is going back in a really limited way, which is what we wanted. It won't be until we get to an even safer zone that people will really be going back in person, and we'll have to see what happens then too. But anyway, the 22nd, today's the 14th, so we're still waiting. Now, it doesn't mean that you would have to wait 14 days to see. I would expect that by the end of this week, we'd start to notice if there's a bump in cases or not. So the answer is, I don't know, but we're going to know really soon. And how can people protect themselves? it's that, people, time, and space thing again. So try to not be around as many people who are not already in your household. If you're going to do it, be around them for a shorter amount of time if you can. And then try to create as much space, that 6-foot space, as much as you can.
Our next question is from Isabella Moretsky.
How does COVID continue to affect the body after the infection is gone?
Yeah, so some people, you may be asking that because you've heard of what we call long haulers or long COVID. So some people, after they get sick, they feel tired for weeks or months. There can be just a long cough that still, just persists. There can be that loss of smell can last weeks. So that's not even counting all the other things that we talked about. If you get really sick, if you get ICU sick, you're going to be pretty weak afterward. People have to have physical therapy just to learn how to walk again. People have to deal with the loss of muscle mass. So, and just, the inflammation of the heart and those other things that we talked about. Some people end up on dialysis, and then we have to wait and see if their kidneys recover. Fortunately, that's a minority of people, but those are some of the long-term effects. Also, I forgot when we were talking about how to protect yourself, I totally forgot to mention masks. So face coverings, the World Health Organization recommends 3 layers. The CDC says at least 2 layers, but some kind of a face covering also helps to protect everybody from acquiring the infection.
Why does COVID-19 seem to attack populations more than any other?
So yeah, right now we do see that Latinx people, and especially Latinx young people, are affected more than younger white people or even younger Black people in San Antonio. And again, that may have to do, it's not, the virus doesn't discriminate, right? So it's got to be in how people are getting exposed to the virus. So it may be that we see more Latinx people working those frontline jobs where they're exposed to more people, or having to be around people either at work or on the way to work or at home in a way where you're not able to distance and protect yourself. So that's that's called a health inequity. And one of the things that we try to do in public health is look at the systems that create that. If everybody was able to have paid sick leave, for example, that's one example of a policy that would help people protect everybody, not just the person who's sick.
Thank you for that. Gabriella, would you like to ask your question next?
Hi. So as teens, do we have an advantage of not getting COVID-19 over people who are older than us?
So people who are younger than 10 years old, which is not teenagers, do seem to be less likely to acquire and possibly less likely to transmit COVID, although we don't know yet. But people who are older seem just as likely to have an infection, but you may be less likely to get really sick from it compared to somebody who's older.
So there are a few questions in the chat that I can see. One question is from Letza, and she has to say about how many doctors/specialists are needed to help with patients in COVID.
Wow. I don't have a number off the top of my head. I know that at different points we've not had enough respiratory therapists. There are also, I think that there's a need for more social workers. There's a need for trying to think of some other categories. Doctors who specialize in taking care of older people who are called gerontologists. We always need more of those. So those are some examples. That's probably not the same answer I'd give if I had time to really research that question.
Thank you.
Our next question is from Madeline Aldrich.
Question is, why do you believe that COVID became so prominent in the United States when there are other diseases that are much more contagious and deadly? So why did this become a pandemic when others have not?
So measles is an example of an infection that's much more contagious. You can walk into a room where somebody had measles and like they walked in and left, and you walk in 2 hours later, and there's a pretty strong chance that you could catch measles. COVID is not as infectious as that. It is so far more deadly than regular flu. And in fact, what we're finding, again, these numbers, we're not used to having to produce so much data in the middle of things. Usually when you see numbers about deaths, they tend to come out after a few years because there's so much cleaning of the data that you have to do. But so I think this number will change over time is what I'm saying. But right now for Bexar County, the chance of dying if you acquire COVID is more than 2%, whereas with the flu, it's 1/10 of 1%. So that's 20-fold. And so that's one of the reasons that people pay so much attention to it. The other thing is how many people get hospitalized. If COVID was just like a regular cold and people would catch it and stay home and get better, then it wouldn't be a big deal. But because so many people end up in the hospital on a ventilator and they end up on that ventilator for months, that backs up everything else that we rely upon hospitals to do. If you are in a car accident or you want to deliver a baby, you want your hospitals to be available. So a lot of this is driven, is built around how do we make sure our hospital systems don't get overwhelmed.
The question that Dylan was trying to ask was, can the COVID virus get in through your eyes or your ears?
Not so much in your ears. People who work in hospitals with COVID units, they actually have to wear eye protection. When there's a higher level of COVID in the community, the recommendation is that everybody who's a medical worker wears eye protection, which could be a face shield or goggles, because you don't know if maybe the person in front of you has COVID or not. But it is more of a precaution. We believe that mostly it's transmitted by breathing the same airspace and breathing in some respiratory droplets from somebody who has COVID.
Thank you for that. Thank you for your question, Dylan. Gavin, would you like to ask your question next?
Yes, thank you. A question was, is it better to have classes outdoors in your professional opinion?
Yeah, absolutely. And in fact, there was a time when this country had to deal with a lot of tuberculosis and had outdoor classes at that time, and it made a huge difference. If you can't be outdoors, then opening the windows. The downsides of all of these are, I've been talking to principals and school districts and teachers, and people need to be able to go to the bathroom. Some kids have asthma and can't be outdoors all the time. There are lots of other things to think about, but will there be less risk if there's good ventilation or if the windows are down or if you're outdoors? Yes.
Thank you for that question, Gavin. A question in the chat from Amelia is, will I be able to donate blood or will I need to show proof of a negative test result?
So it turns out that when you go and donate blood, they'll test you.
So based off my question from earlier, so do the symptoms that people continue to have, how long do those usually last?
It varies, but I'd say weeks to, so here's the other thing, COVID's only been around since about December, right? So it is hard to say, but most people feel better, I'd say, in that 1 to 2 month range. And people who were in the ICU, they're going to take even longer than that to build back to the strength that they had.
Okay. So my question is, what are some of our responsibilities to be safe as students going back into like school buildings and stuff like that?
To wear a face covering, to keep your distance whenever you can, and be kind to each other and yourself.
Thank you. Our next question is from Trisha Ballion.
So what do you think is the possibility of being able to have a vaccine within around the next year?
Around next year, I think it's really possible. By the end of this year, that would be really hard. Remember, one of the things to keep in mind is it's just going to take time to know how well it works, right? So you give somebody the vaccine and then you wait a while and then you see whether they, they have to be exposed to the virus, and you have to see whether they catch it or not. And sometimes you might want to see if they're re-exposed 6 months down the line, if they're still immune, right? We're only going to know those kinds of things over time.
For that question, Trisha. A question from the chat was, how has COVID-19 affected most people? And do they get it bad and others don't? Like, why? I'm sorry. Mm-hmm.
Why do some people get it bad and others don't? You don't need to apologize. So I don't know the answer. There's still a lot we need to learn about this virus. Maybe you can be the one who figures that out.
Do you believe that COVID-19 will ever be 100% eradicated?
Oh.
And if so, what year?
Well, actually, I would say most people think that it's going to be endemic, which means it just keeps coming back year after year. But over time, we have more treatments, more people who are already immune to it, so it becomes less threatening. Some viruses do just kind of go away after a while, so that's also a possibility.
Thank you for that question, Maddie. Gabriella, would you like to ask your question?
Yes, thank you, Savannah. Hi, Dr. Woo. So I'd like to ask, so flu season's approaching. How are we going to be able to differ from the flu and the coronavirus?
Most of the time, you're not going to be able to tell, right? And you can actually have both infections at the same time. So you can do a test to test for each one of those things, but just based on symptoms, most of the time you're not going to be able to tell. I would say the loss of the sense of taste or smell, that's highly specific to coronavirus. But other than that, yeah. So I encourage everybody to get their flu shot this year, so at least you can have some peace of mind that, okay, it's not likely to be flu. I don't know how much that helps, because then maybe you think, oh, well, that means it is COVID. I don't know. But it does help us diagnose things a little better if you've had your flu vaccine.
Thank you for that, Gabriella. One of the questions from the chat is from Mr. Nardozi. It says, one of our 9th grade students from CASTEM also has the same question. It says, for those with environmental concerns, what is the waste management plan, if any, to address the used mass disposal?
The used mask litter, was that the question? Yeah. Well, it is the same as with any other kind of waste, right? I mean, because if you're talking about littering on the ground, public education to say, hey, that's not cool. Reusable fabric masks do help with that. Like I said, just try to make sure that yours is at least 2 layers. The World Health Organization actually has a whole video, if you haven't seen it. It's about 6 minutes long about the different layers of a fabric mask.
Thank you for that. Dr. Rodriguez, would you like to ask your question?
Sure. Hello, thank you, Dr. Wu, for being here with us today. I appreciate all your knowledge and sharing it with our kids. My question is, the HIV virus has been around for some time now and there's no vaccine. Could this be the case too with COVID? Or is COVID easier to combat because more attention worldwide is being done in terms of finding a vaccine?
I think it's a virus that mutates a lot less than HIV, so we can be more optimistic that we will have a vaccine. But yeah, there is a risk that after all this work, there won't be one at all. Now, on the other hand, we already have some vaccines that are moving into phase 3 trials. So preliminarily, I think things look good that we actually are going to get one.
Okay. I have heard many rumors, or well, I believe also that the brain is pretty powerful. So, will thinking about the COVID-19 virus negatively, like if you do get it, could that increase the risk of death? Because you are psychologically like getting into your mind that it could be potentially deadly to you. I don't know if I explained it well.
So if you already have a mindset of like, this is going to kill me, and then you do have the infection, are you more likely to die? Is that your question? So not, I would say maybe not literally from a biochemistry standpoint, but if that mindset makes you do things where, you know, you're fatalistic, you're not protecting yourself, or you well, I mean, or I don't know, that didn't come out right. You know what I really don't like is wording where that blames people, but if you are taking risks, or if you decide after you have an infection, well, I think I'm doomed, and so there's no point in taking any other measures, then that could affect things. But yeah, I know what you mean about the mind too. That's why there's such a thing as the placebo effect, right? Because the placebo effect works for a good number of people. So maybe, that's a not evidence-based answer. There's a lot about the mind that we still don't know too. But, you know, people who are interested in studying it, like you can devise some clever studies to look into that. Placebo studies have always fascinated me.
Thank you for that question, Letta. It was a really great question. Our next question comes from Maddie. Would you like to ask your own question?
Yes, ma'am. So my next question is whether or not it is always a 2-week incubation period, or does that vary from person to person?
Oh, no, it varies. So it's anywhere from 2 to 14 days. What that does mean, though, is a lot of people are testing at the wrong time when they find out they were exposed today or yesterday, and they're like, oh, I'm going to go and get tested today. It's too early, right? Your chances of getting a positive test on day 1 is 0%, right? You've got to at least wait a little bit. And we think it's best with the current tests on the market to wait somewhere between 5 and 8 days to have a higher chance of it being positive, but really it could still take 14 days for some people. There's no telling. Everybody's different.
What an awesome question, Maddie. Our next question comes from Mariana. Would you like to ask your own question?
Yes, I would like to. I have known the symptoms for COVID-19 or shortness of breath. Is there any other specific symptoms out there that we should know of?
So fever, trouble breathing, there's actually, people can have nausea, vomiting, muscle aches, just general body aches, coughing, sore throat, that loss of sense of taste or smell that I mentioned, and maybe diarrhea sometimes. And the little ones are more likely to have those stomach symptoms.
What a great question, Mariana. Our next question is from Amelia. Would you like to ask your own question, or would you want me to read it for you?
I can ask it. So I wanted to ask, do you think that there are dangers in trying to produce and release a vaccine so quickly, because we might not know some of the long-term side effects that you would see with any other FDA-approved drug or vaccine?
Yeah, well, so with drugs, there's sort of a saying among doctors not to be either the first or the last to prescribe a new drug. Let me back up and say that there are 4 stages that drugs and vaccines go through to get on the market. And so the first stage is just a really small group of, well, it could even be animals, just to see if it's safe, right? And then in the second and third stages, you test on larger groups of people. You start to check about what's the right dose. And of course, you're still looking to see if it's safe, but you're also looking at how effective it is. And then in the fourth stage, that's the drug's on the market. And so by then you're looking at the effects in, everybody who might be taking it. Maybe that's hundreds of thousands of people. And so sometimes there's a drug that comes on the market, and then a year later you see, oh, it's been recalled because they found out that it's bad for the liver in a small proportion of people, but you didn't know that earlier, right? I think one of the differences between a vaccine and a drug that people take every day is that a vaccine is a one-time dose. So most of the time when people have had bad side effects with vaccines, it started sometimes bad side effects, number one, they're very rare. And the most common side effect is just pain where you get your shot with any vaccine. But if you do have bad side effects, you're usually going to know it within those first couple of weeks. So the good part is, I think we're going to have a good idea about safety by the time the vaccine comes on the market. What we're not going to know is how effective it is over time. So it really is going to be up to every person to think for themselves about well, okay, is the trade-off worth it for me? What I commit to, what we can say at Metro Health, is that we're going to be reviewing all the science that comes down. We're getting information even now from the feds, as well as, there's things being published, although not about the current vaccines. So we'll review that. We'll share it with the public, and people will make their own decisions. But I think it'll be safe, but we won't know how effective it is for a while.
Okay, thank you. And our next question comes from Trisha Ballion.
Hi again. So in your opinion, how do you think that we as a nation on a whole could have handled the pandemic better, to where it would have been suppressed sooner than the way it is now?
I think if we had, in a coordinated way, all sort of united and said, we're all going to agree that the virus is real, and we're all going to distance and wear masks and limit our time with people outside of our households, that could have made a difference. Hard to know. But there's that, and the supply chain is still an issue. So that has to do with the number of tests that are test collection kits and That was a problem definitely all over the country. In the beginning, it's a little better. And definitely it's better in San Antonio now. The other thing is people really took public health infrastructure for granted. They didn't know what we do have or don't have at public health as far as contact tracing. So that's, you've got an infection, so we call you and we say, hey, can you tell me who you've been around in the last few days before you got sick? Because those people, they should probably stay home so that they don't infect other people, or at least just in case. They should stay home to see if they develop any symptoms. It's been a challenge to keep up with that, both as far as having all the people we need to have at the health department. We have that now, but we didn't have it in March or in April. And even now, there's still a trust and communication barrier that if one of you is brilliant enough to solve, I'm all ears, because, about 60% of people, when we call, they don't answer. And there are lots of different reasons that you might not want to answer a call from the government. I get that. But if we're all in this, if there's really a sense of, hey, we're all in this together, then I would hope that that's a little less likely. I don't know.
It was still a really great response. Thank you, Dr. Wu. One of the questions from the chat is from Dr. Pazat, and she says, have any studies shown that people have tested positive to both COVID and flu?
Yes, that it's not likely, but yes, people have.
Thank you for that. Our next question comes from Gavin, and it says, how much have you all actually learned about the virus?
Kind of a hard question to answer, but we have learned some treatments that we don't have cures, but we have learned ways to help people get better faster, both when they're really sick and also when they just started to get sick. And we've also learned a lot about how contagious or not contagious it is. You may or may not have been paying attention to the news back in February or March when we were accepting people from China and from cruise ships over at Lackland Air Force Base here in San Antonio. And at that time, the CDC told us that even just being exposed to somebody for 2 minutes, that somebody might catch the infection. Then they walked that back to 10 minutes, and now we use the cutoff of 15 minutes. So it's not as infectious as we used to think at first. And you'll also see that people don't dress in those moon suits like they used to take people's tests, right? They wear a little bit less. They still have their eyes and their nose and mouth protected, but it's not quite as infectious as either we thought, or maybe we just wanted to be on the safe side at first, right? Because we didn't know anything. We didn't know the difference between this virus and Ebola at first, right? Well, I mean, we did know it's a coronavirus, but now we feel a little more comfortable with it.
Thank you for that. Our next question comes from Dylan. He says, if I got tested for COVID-19 and my results come out negative, can I still get infected with the virus later on?
If your results come back how?
Negative.
Positive or negative? Negative? Yep, you can still get infected. And in fact, you might actually be infected. Remember, that negative test is just a snapshot from the day that you took the test. So if I'm exposed, if Dylan is exposed to somebody who has the infection and then gets tested on day 5 and is negative, maybe he's just still or she, I don't know who Dylan is still incubating the infection, and then they're going to turn positive on day 8 or day 9, right? So if you were exposed, it's important to stay home even if your test is negative for 14 days.
So another one from the document was from Trisha Ballion, or sorry, one of the asked questions was from Trisha Ballion. Why do you think the government has stopped the CDC from being able to properly intervene and control the spread?
You know, I'm going to, I can't look inside somebody else's heads. There's a lot of politics that, you know, hasn't affected public health before, hasn't affected you all in schools and people who run schools before, and it's affecting nursing homes. It's affecting really every place that COVID goes. Politics is also going to. I think that sometimes I just recommend we pay attention to the science and not so much what we wish the science would say either way.
It's fine. I was just curious about like whether does the brain not keep things at a equilibrium, or does it like send attention around the lungs?
Does the brain keep things at an equilibrium, or does it center attention around the lungs if someone catches COVID? Oh, that's so interesting. So to the extent that the brain is involved, I mean, a lot of these immune defenses happen without you having to think about it, right? Your brain isn't telling your white blood cells to go to where the infection is, but it does take away from that. So your white blood cells will focus on your lungs and possibly not as much on other parts of your body, although I also want to say that usually there are enough white blood cells to go around that people can have infection and inflammation in more than one part of their body at once. I don't know. I hope that's enough of an answer.
Okay, so with the protests that happened back in June, about how much did the numbers of COVID-19 rise, and could have we prevented the rise of the numbers of protests?
So as far as we could tell, we did not see a bump in numbers after the protests. And similarly, there was a large, so, and I'm just going to say, because, you know, politics is infiltrating everything, and that's perceived as how come, you know, public health didn't get super excited about or didn't want to stop people from protesting. Well, it's outdoors, and I will say that there was something on the conservative side. There was a large rally on the 4th of July outdoors at Mount Rushmore, and also we did not see a large increase in numbers after that. Now, on the other hand, in Sturgis, there was a motorcycle rally. I want to say that was in the Dakotas, although possibly was in Montana. I'm sorry. But the outdoors part was mixed with people also going inside, going into shops, going in bars, and there has been a large outbreak associated with that part. Now, I'm not saying that you can just completely let your guard down outdoors. I still wear a face covering. I still keep a distance, but I feel a lot more comfortable doing whatever outdoors, including protesting, compared to indoors activities.
Thank you. And we actually have a question from the YouTube Live from Erica Chu Allen. We know that physical distancing and face masks are important in the prevention of COVID transmission, but why aren't medical professionals encouraging healthy lifestyle habits as another line prevention?
You know, I have read about how in other countries people are talking about that a little more. So what that's referring to, it's not going to prevent you from acquiring the infection, but we know that people who have died tend to also have other chronic diseases, diabetes, high blood pressure. Those are some of the common ones here in San Antonio. So if you don't have any of those other conditions, if you have you know, if you have healthy eating and active living, and those things help you not have diabetes or high blood pressure or heart disease or lung disease, then you're more likely to escape your COVID infection without any long-term consequences. So yeah, that is something we can do. Thank you.
For that, Amelia, and that question from Erica. A question in the chat is from Abriella, and she says, I would like to ask why doctors aren't pushing to improve our immune systems.
Why doctors aren't pushing to improve our immune systems? Well, I can't speak for all doctors. I know there's some who do. I think that some of the things that you can do to protect yourself that improve your immune system include the exercise that we were just talking about, getting enough sleep. Those are, if I had to pick some, those are the two biggest ones. You know, eating right, yes, but sleeping will help even more. There are all kinds of things that your immune cells are doing while you sleep. You know, I can't say that I've read all the details. I know I saw some headlines. I'm guilty of just looking at the headlines where the public health leader of Sweden said he regretted that policy. I will say one thing that I did pay a lot of attention to, because I've been closely overseeing all the outbreaks at nursing homes here, is that Sweden had a lot of deaths in nursing homes, far more than any other country proportionately. And so, you know, we haven't as a society had a discussion where and I don't know that Sweden did either, where they said, well, you know, okay, we're willing to sacrifice older people. It didn't work out entirely great for Sweden. On the other hand, they didn't have any kind of a lockdown or partial lockdown. Is there any over-the-counter medicine you can take if you feel like you have COVID or flu symptoms to prevent the virus? So if you have symptoms, then it's too late to prevent it, right? But you can take the same over-the-counter stuff that you would take if you had a cold. That just depends on what's bothering you the most. So if it's a headache, then you can take Tylenol. If it's a sore throat, then you can take, you know, some kind of cough syrup or not so much cough syrup as a sore throat lozenge, right? So it's really just targeted at where you're feeling bad. Do we run the risk of spreading the virus through pools or water fountains? So no, because pools have that chlorine, right? Water fountains, yeah, I mean, that has more to do with, you know, how some people put their mouths really, really close to the spigot. So that I'd be cautious of. So it just has to do with that kind of contact. You know, if you're in a swimming pool that has chlorine, but you're within 6 feet of somebody, then you're, again, you know, getting really close to them. So all of those will still apply, but just through the water itself, no, not as far as I'm aware of. And what Carol Harrell had a question about what trained me to become our medical director. I did get a master's of public health, and I think that's the one that's most on point to being a medical director at a public health department. I got it from UT School of Public Health, and it was a lot of fun.
In the amount of space between people that y'all had considered?
So the World Health Organization uses 3 feet, actually. The CDC, you know, I don't know if y'all are familiar with those curves with standard deviations, but, you know, the idea is that the farther you go out from somebody, the more likely you're on the skinny part of the curve, that if they sneeze, there's a very, very, very small chance that you'll be able to breathe in any of the particles, right? So became a question of how big a chance are you willing to take? And the CDC said we're going to be even more conservative than the World Health Organization, and we're going to go with 60. It's not a zero chance, you know, but it is. Oh, do I know the number off the top of my head? What percent? Gosh, it's definitely less than 10%. It may be, shoot, I don't know the number right now, but you can find it if you look.
Dr. Woo, that concludes our question and answer session.
I am always encouraged to be around the next generation, because it gives me hope. When I get tired of my own generation, y'all are going to come along and replace us and do so much better. Awesome. Thank you, Kat. This is fun. I am you know, ready to come back when we know more about the vaccine, and we'll talk more then. I'm totally willing to do that.
Thank you. So, hi everyone, my name's Abriella Allen. I'm a sophomore at Cass Med High School. So I chose Cass Med because I would like to go into marine biology one day, and I believe the school will get me very well prepared for it. So our journey doesn't end here. Over the next couple of months, we will continue to connect with health and community experts to learn more about contagions and collaborate as students and share our learnings. We thank everyone for joining us, and we are extremely thankful for our partners today, the students and educators from John Jay Science and Engineering Academy. If you have any questions regarding our work, progress, or if you would like to participate, please email us at info@cassmedschools.com. And thank you, everybody.